Hi everyone, welcome back to my channel. My name is Lisa Flanders. I'm a physiotherapist in Ottawa, Ontario, and I practice in women's health and pelvic floor physiotherapy. Today on It's Not TMI, we're going to be talking about Kegels. You'll notice on my sign there's a question mark after the word Kegel. This is because a common question that I hear is, can't I just do Kegels to fix my pelvic health concern? Well, if that was the case, then I would be out of a job. It's unfortunately not that simple. So I want to talk a little bit more about what Kegels are and whether I think they're an appropriate exercise for you to be doing. So what is a Kegel contraction? So a Kegel contraction was originally described in the 1940s by an American gynecologist. It's a repetitive contraction and relaxation of the pelvic floor muscles. It was traditionally used to treat things like urinary incontinence and pelvic organ prolapse. So I'm all for pelvic floor muscle strengthening if that's what your body needs to help you reach your specific goals. However, there are a few reasons why you shouldn't be doing just Kegel exercises. So number one, Kegels are not specific. It's like telling someone to just go do squats or go do sit-ups. There's no parameters. Number two, there are many pelvic floor dysfunctions that are caused because the muscles in the pelvic floor are too tight, so they're already sitting in a shortened position. Things like stress urinary incontinence, painful intercourse, tailbone pain, constipation, urgency, frequency of urination, all of these things can actually be caused because the pelvic floor muscles are too tight. So functional muscles have to be able to contract fully and relax fully. Pre-contracted muscles are not functional muscles. If I walked around like this all day long and then I went to go reach for something and my bicep couldn't lengthen, that wouldn't be very functional. On top of the fact that I would walk around looking like a Tyrannosaurus Rex all day long. But those women who have very tense pelvic floors shouldn't really be doing Kegel exercises, because if you already have very tight muscles and we start to try to strengthen in this little range of motion, it can actually make your dysfunction a lot worse. So if you're not sure what camp you fall in, seeing a women's health or pelvic floor physiotherapist is going to be the best way for you to identify your specific needs. Number three, most women do not do Kegel exercises effectively. I'd say 90% of the women that come into my clinic are actually doing their Kegel exercises wrong. I see things like holding your breath while you're doing your pelvic floor muscle squeezes, or just squeezing the very back part of the pelvic floor, causing a lot of pelvic floor asymmetry. So if you're not doing your Kegels effectively, this is actually going to lead to more dysfunction. Number four, Kegel exercises alone are not dynamic and they're not functional exercises. So functional exercises are ones that we can apply to other tasks that we do in everyday life. An example of functional exercise would be squats, which then apply to getting into and out of a chair. Typically, when you read a magazine that's talking about doing Kegels, it talks about doing them while you're sitting in your car stopped at a red light, or while you're standing in line at the grocery store. Now, I've never had a client come into the clinic and say to me, oh, I get urinary leakage while I'm sitting in the car stopped at the red light, or when I'm standing in line at a grocery store not doing anything else. So why are we practicing doing an exercise in a way that's not functional to what our concern is? If you have leakage, urinary leakage when you are running, jumping on the trampoline, or skipping, then we need to apply that task to a functional movement. If you are having urinary leakage when you're laughing, coughing, sneezing, anything where there's like a big increase in pressure in your belly, then we have to apply the same principles and we have to work the muscles under that increase in intra-abdominal pressure. Number five, our pelvic floor muscles, the ones that we are typically strengthening while we're doing Kegel exercises, are only one aspect of our deep core system. They work together with our diaphragm, which is our primary breathing muscle, our deepest abdominal muscles called transversus abdominis, and a small group of muscles in the back called multifidus, which come from the sacrum to the lumbar spine. Now, all four of those structures have to work together for us to have a functional deep core system, which brings us back to how important breathing is for any sort of pelvic floor muscle strengthening and any sort of Kegel contraction. If you have pelvic floor dysfunction and you're not sure if you should be doing pelvic floor muscle strengthening, then I highly recommend that you book in with your local women's health or pelvic floor physiotherapist. They're going to be able to do an assessment and determine a treatment plan that is right for you and your unique needs. Thank you once again for tuning into my channel. Remember, it's not TMI. Tune in again next time where I'm going to be answering more of those questions that you might be too embarrassed to ask. Thanks, guys.